Hey, good afternoon. Dr. Erickson with Executive Health Solutions. Just trying to give you a little bit of, this is more of an education video and a little bit of technique on a move that a friend had asked me to assess her. Really, it's the right leg, it's the back of the leg in the hamstring area. She'd fallen down the stairs twice, really, fallen down 2 different times. The pain is in the back of the leg, kind of it was in the low back and buttock and now into the hamstring. But the key here is when we talk about it and what makes you better, what makes you worse when the pain comes and goes, it's really sitting. It's sitting in the chair at work brings it on. Standing and walking around generally feels better. Test the strength, the good hamstring strength, no increase in pain in that. So when you think about the differential diagnosis and you think about, okay, it's pain in the leg, oh, I hurt my hamstring. That's the common thing you're going to think of because that's where that muscle is. But when you're sitting, that muscle is on, it's basically relaxed. It's shortened. You're not actively moving it. And then if the sitting is what causes it being flexed and seated, the causing it, and then you stand and walk and actually use the muscle and it feels better, and you can resist it with manual resistance with my hand, and she can pull back and it doesn't increase the pain. We have to, at first, at least assume a lumbar spine problem that just referred to the low back, or sorry, just referred to the hamstring, the right hamstring area. But now, even if we didn't have any of that information, we have to, you have a duty, a responsibility to, at minimum, screen the lumbar spine and make sure the problem is not there. I mean, that is absolutely has to be done with any situation, any pain in the back, low back. Sorry, that's the same thing. Low back, hip, leg, knee, calf. Any of those still have to be screened out with the lumbar spine. That's kind of shaky. So I'm going to reposition the camera here and then show you what we'll try first. Okay, it's going to be a prone, which means lying on your stomach. Extension in line, kind of a really bad push-up that we need to assess that the low back or the lumbar spine into repeated extension because, like I said, we talked about her being worse with sitting and being in a flex position and then being better when she's upright and moving. So this is more than likely what's going to change it for her. And when I thought about that, I said, okay, I'm going to try to share this with other people that may have that similar pain where they're thinking, man, I hurt my hamstring somehow. It's not going away. It's not going better. They tell me to do these stretches, do these hamstring stretches, do these exercises. It's not any different. It could be because it's not actually a hamstring problem at all. So let's put this down here. I'm gonna see if I can get this just positioned just right. About there is probably pretty good. Okay. So you'll start with lying face down. Actually, you'd start with getting a baseline or a location of the symptom, how far in the leg it is, where it's at, and then the intensity, how much. And then we're going to keep the low back and the hips completely relaxed. You'll have your hands on the floor, or if you have a table similar to this, it's possible, but more than likely on the floor. You'll push straight up, elbows, focus, elbows locked. Breathe out. Let the hips fall down, so it's not this, it's not here. It's down here, gotta be relaxed, so muscles not tensed. It's gotta be relaxed in the lower back and butt muscles. 1, 2, 3, come back down. Brief, come back up again. 1, 2, 3, and down. Focus, focus, focus. There we go. Do this by myself, so it's I don't know why it's doing that every time. And come back down. So we're going to repeat this a good 10 or 12 times and then stand back up and see if it's any different. And down. There we go. Up. And down. And so after a good 10 or 12 times of locking, breathing out, then when we stand, we have to kind of reassess and see where the symptoms are at location-wise and intensity-wise, if they feel better or worse. If they started at a 4 out of 10 and it changed, more than likely what will happen with this movement, based on her symptoms, I'm hoping if it's you're very similar, it'll be a similar outcome or net result is the pain will either decrease in intensity, or it will feel like it's moving from the hamstring. It's moving up the back of the leg, and you may feel it more in the butt, cheek, or in the low back. And that's centralization. That's probably a good thing. You need to keep doing those for a good 24 to 48 hours. Let's see what happens if it completely goes away, if just a little bit left. The way you'd want to stop and not do it would be if the intensity significantly increases, 7, 8 out of 10 pain, or if it starts to go further away, like below the knee or into the calf or heel, then that is technically wrong. It may be the direction, maybe the load, there's different things. You're gonna have to drop me a line, get a hold of me, either leave a comment in the video or website, www.exechealthsolutions.com. There's a link to my email there, and then we can get that fixed for you. But the majority of people that have similar symptoms to my friend here that I'm talking about, pain with sitting, had a fall, pain that goes, it's unilateral, just one-sided, don't know why, it comes on when I sit, it feels better and goes away when I walk around, probably a referred pain from the low back, which this one most of the time will take care of. So again, Dr. Chris with Executive Health Solutions, your concierge physical therapist in the Omaha, Nebraska area. Love to serve you, busy professionals, business owners that are time sensitive. I like to give you time, freedom, and convenience by coming to treat you at your office, at your home, at your gym, or in this case, I'm actually in one of the rooms in the clinic in Elkhorn, Nebraska. Okay, that should get you going to start with. Thank you very much.